podium for reading.
Kia ora koutou katoa, nau mai haere mai ki te manatu hauora. Welcome back to the Ministry of Health for today's update. Today I'm reporting there are 36 new COVID-19 cases in New Zealand as at 8 o'clock this morning. More details on the new cases will be provided via our website shortly and updated as new details are confirmed. But I can give you the following information. Of the cases today, over half are directly related to overseas travel. So these are people who have returned to New Zealand recently and have become symptomatic, been tested and confirmed as cases of COVID-19. Most of the remaining cases are close contacts of a previously confirmed case or are associated with an event where there were confirmed cases already, for example, the Hereford Cattle Conference in Queenstown. Across all cases, there remain currently 2 that we cannot be certain where the infection came from, and we are therefore treating them as community transmission. The Prime Minister will update the country later on the alert level, which is a result of and informed by those cases of community transmission. Contact tracing for all cases is ongoing. What I would like to reiterate here is that we have expected and indeed want to find any cases of COVID-19 in New Zealand. We have expected them because we have had people returning from a range of places around the world that have higher rates of COVID-19. And the important thing, of course, is that we find these cases, we isolate them, we identify close contacts, and we isolate those people too. So our contact tracing efforts are incredibly important, and they are being ramped up to support this public health response. Just over 1,200 laboratory tests were carried out yesterday for COVID-19, and that brings the total number of completed tests to over 7,400. In summary, the total number of confirmed COVID-19 cases in New Zealand is 102. Just to reiterate, most of our cases are still from people who have travelled to New Zealand from overseas. An increasing number of cases are close contacts of those who have travelled back, or those 2 cases of what we think is likely community transmission. So, this makes our core public health messages that we have been reiterating now for some weeks even more important. Physical distancing, cough and sneeze etiquette, and most importantly, of course, washing hands, and if you are unwell, do not go out. It's very important that people pay attention to these messages to ensure that all of us are playing our part in preventing transmission of COVID-19 in our communities. And finally, just to reiterate, there is clear information on the COVID-19 website about people for whom it's recommended they now stay at home, in addition to those over 70, that is people under 70 who may be immunocompromised or have relevant pre-existing medical conditions. So if you have any doubts, please do check the information on the COVID-19 or the Ministry of Health websites. Thank you, and I'm open to questions.
Where exactly are the 2 cases that are community transmission?
So one of those is the one in the Wairarapa that I mentioned yesterday. The other one is an Auckland case. It's not the one that we had talked about from Friday, because we believe that the case from Friday, the link was through that person's partner who had a lot of contact with overseas visitors and who was symptomatic before the case who we have confirmed.
So that Auckland case is a today case of community transmission?
It was one that was reported yesterday.
People are waiting hours to get through to Healthline. What's being done to increase the capacity to deal with calls?
We continue to increase the capacity at Healthline, and what I have just been told is that the average waiting time yesterday was 30 minutes.
So what's being done? Are you putting more staff on? I mean, what are you actually doing at Healthline?
A range of initiatives. The first is more staff, and in fact Healthline have been really scaling up their staff now for some weeks. Secondly, we've linked in other government health lines, particularly the all of government helpline, because that is able to answer a lot of people's questions about support, particularly if they're in self-isolation. Third, there is a clear self-registration process on the website for people who want to self-register. They don't need to ring Healthline. And fourth, I'll just emphasise the message I give every day. If people can use Healthline to ask for information about their health, not for other information, there is excellent and constantly updated information on the COVID-19 website.
What should people do
can
if they
you
can't
explain
get through?
how?
If they can't get through,
Yeah.
if they have what they believe is a relatively urgent medical issue, then they can and should ring their own general practice and get advice there.
Can you explain how asymptomatic people are now testing positive, and whether that means we need to increase or change the case definition for testing?
So I don't think I've said today that asymptomatic people are testing
No, there
positive.
was the case in a rest home where the man was apparently felt completely fine, but has yet tested positive.
Yes, so if you look up to the data from internationally, some people have a very mild, or what we might describe as even subclinical illness, especially children. So yes, there will be people who, for example, we test because they are close contacts, or they may be very mildly symptomatic, or very early on in the disease, and they may test positive. So we would expect that to happen, and that's why we will be continue to be rigorous in that close contact tracing, isolation and testing if necessary.
So it's like
you said all 102 confirmed cases still have active contact tracing underway, is that correct?
The earlier ones, the contact tracing would be well completed. In fact, those people will have fully recovered. The new cases, the 36 active contact tracing, close contact tracing is underway, and in some of the ones from the last couple of days, they'll still be talking to and isolating close.
So how many staff do you now have working on those tracing efforts, and how concerned are you about a potential backlog, I suppose, building up and potential transmission occurring?
So we have anticipated this increase in cases, and in addition to the capacity there is in all our public health units, we have stood up a team here in the ministry that is able to supplement the public health units, and it can manage at the moment up to 50 new cases a day in addition to that public health unit capacity, and it is also scalable up as and when needed.
There's
So
an increasing
Ministry of
number of New
Health
Zealand
is-
scientists pushing to raise the alert level straight to 4 right now. Why are you holding off from doing that?
So that's a government decision, and we continue to provide advice to the government about the alert level, and as I've hinted at, the Prime Minister will be talking about the alert level actually within the next hour.
What
The
about
Ministry of
science?
Health has ordered all DHBs with dental clinics to stop dental appointments at the hospitals. Can you talk through that, and what other decisions are being made at a DHB level to reduce the spread within hospitals?
So there are two things there. One is all our district health boards have, and the hospitals have put in plans about how they would scale down their current activity, in particular elective surgery or elective operations and outpatient appointments, and to free up capacity and staff if there was an increase in people requiring hospital level care. The second part of that, of course, is that doesn't mean people won't be seen if they need care, but many of the outpatient appointments, for example, the follow-up outpatient appointments, could be done rather than face-to-face, could be done with phone calls. The other thing, of course, is that most hospitals are now putting restrictions on visitors, and that's a way to protect, of course, people in the hospital and reduce the risk of any COVID-19 infection.
The
So how
police
does that
commission
connect
says
to
that we should
the
be doing.
dentist?
Sorry, I've still got a follow-up here.
How does that connect to the dentist, that you're stopping that to free up staff, or to just eliminate the amount of people coming into the hospital? What?
It's freeing up capacity in the hospital, because remembering that in addition to the dentist, they will have other people working with them who may be needed in other parts of the hospital. Question here?
You said you anticipated this jump in cases,
Yes.
but a lot of people coming back to New Zealand from places where coronavirus is more established. What are you expecting it to do in the coming days and increase quite substantially?
Well, I would expect that we will continue to see more cases each day. And again, we're doing a lot of testing now, between 1,200 and 1,500 or 1,100 and 1,500 tests a day. Our case positivity rate from our testing is just over that. It's between 1 and 2%. Australia's is just under 1%. I'll give you a comparison. To date, South Korea's has been about 3%. The UK about 5%, and the US about 13%. So we're doing a lot of testing comparatively, and our case positivity rate remains quite low. We want to keep it there, but we want to find all the cases. So we're testing where there is suspicion.
So what have you advised?
Advice to the government around that alert level, with today's jump in cases, are you advising that they lift it up to level 3 or 4?
Well, the Prime Minister will let you know that
But
in less than an hour. Can I just, there was a question up at the back or something.
I was going to ask, will you advise the Prime Minister to lift the alert level?
Prime Minister will let you know, because it's a Cabinet decision. Even if we advise something, of course Cabinet has to discuss and make a decision.
You can't tell us what you would advise.
The Police
Can
Commission
you
says
tell
we
us
should
a
be
little bit
doing more
more about
testing.
the...
Do you think?
Sorry?
The Police Commission says we should be doing more testing. Can you do more testing?
Well, if you're talking about Mike Bush, the Police Commissioner, he's very open to and defers to me on the advice around testing, so I'm pleased to say that's still the case.
Can you tell us a little bit more about the drive-through clinics, so why their locations have been chosen and what the rules are for anyone who wanting to use them?
So each district health board and primary health organisation and the local general practices have decided what's the best way to do testing in their area. Some are going for a drive-through type arrangement, and that allows them to put in a process whereby they can keep people effectively isolated in their cars, have them come through and test them through even just winding the window down, in fact asking questions. Other regions have decided to do that in a stationary location, so it just depends what they felt worked best for them.
And anyone could go up to the drive-through clinic? There's sort of no parameters that people need to meet to use them?
Well, people should go if they have symptoms and are concerned, because they won't automatically get swabbed. So what we do want to do is reserve the swabbing and then testing for people who need to be tested. The right thing to do is to ring Healthline to get advice about whether you think those symptoms require testing. Ring your general practice, or if necessary and you are concerned and you think there is a suspicion, then please do go to one of those places. However, it is not a place you go where you say, I feel like I need a test, that you will be asked very clearly about your history, and we want to reserve the testing for people who need it.
On ICU capacity, we've heard some medical staff are being told, in the worst case, there will be rationing, and under 65s will be the ones who are still given ICU beds and ventilators and whatnot. Is that anything that the Ministry of Health is putting out, or is that more hospital by hospital?
Yes, so a couple of comments there. First of all, of course, every action we have taken to date is designed to avoid a worst case scenario, and so we will keep doing that. The second is we do have a stock take of our ICU capacity, and we will be publishing that on our website, and it just shows not just what are the existing number of beds, but the fact that we could triple the number of places where people who required ventilation could be looked after inside our hospitals, both private and public. And of course, the idea there is to not just be prepared, but to complement our measures we're putting in place to actually reduce the risk of that worst case scenario. In fact, we're trying to head that off completely.
Would AIDS be the line you'd use for that rationing?
Not necessarily. But again, just to reiterate, we are taking every action early and fast to avoid getting into that position. You will have seen over the weekend the University of Auckland modelling. You will have seen from overseas modelling of what happens if you do not act. We have acted very strongly on a whole range of measures, and will continue to, with the express purpose, and this is where I agree with all my colleagues across the health system, the express purpose of avoiding that worst case scenario, because that's not where we want to be.
How many of the
What's your
102 cases
reaction
have
to
recovered?
it?
How many of the 102 cases have fully recovered? Do we have a number?
Oh yes, I'm sorry, I did just ask for that information again. Look, I would expect many of those that happened 2 or 3 weeks ago would be fully recovered. The priority for our public health unit staff is, of course, identifying the new cases and following them up, but we are going to make sure that we do get them to just fill out the box on those that are fully recovered, so I can provide that information.
Auckland-based biotechnology company Ubiquitum has developed a technology that's approved by the CDC and the FDA and increasingly being looked at by the NHS in the UK to test for COVID. It says that it can deliver results in 50 minutes. Is the Ministry looking at this technology?
Yes, we're looking at all testing options, and of course one of those is, I suspect this is a point of care testing option, which would help particularly where it was important to either get a rapid diagnosis or where it may take time to get a swab from a remote area somewhere into a central laboratory and the result back. But yes, we have got many offers from overseas for different testing options, and we're looking at all of them. Nothing's off the table.
So what work is the Ministry doing with private sector groups to improve its software, apps, supply ventilators, that sort of thing?
So we've got a number of work streams that not just the Ministry but all of government is working on. Yesterday I participated in a teleconference with a number of very senior and well-known private sector people in New Zealand. And this morning, for example, I spoke with Sam Morgan, who's developed a WhatsApp-based application for getting information out to people and pulling information in. So all of these options and offers are being actively explored. And in the all of government work program now, there is a specific work stream that will be linking with the private sector to make sure we're coordinating and maximising the value of all those offers.
What's your reaction to your stock take? It's taken a few days to get there and quite a bit of resource to work out what exactly New Zealand has on offer. What's your reaction? Do we have enough? Are we prepared?
So you mean the ICU?
ICU and ventilators?
Yeah. Actually, we've had the information for a few days. I just wanted to make sure it had been in front of ministers before we made it public. I was encouraged by it because we have around 180 ICU beds as it is fully staffed, and the ability to at least, with our current ventilator capacity, treble that immediately. And of course now we are planning on, and one of the reasons we want to reduce elective surgery and outpatients is so we can train staff to be able to look after people who are ventilated, and looking at how we can increase our number of ventilators as well.
What sort of, have you had any compliance reports back from people in self-isolation? How many people are obeying the rules?
I've been very pleased to be able to hand that stream of work over to the police and others. So there are other people who are working on the enforcement of compliance with self-isolation. I'll see if I can get an update on that for you. But we did last week see some specific visits by the police to check on compliance, and what we found was very high level. So that's encouraging.
And how much of a case where the Health Ministry advised an Auckland man who had contact with a positive case, who was only a casual contact and didn't need to self-isolate. He got the test anyway and tested positive. Was he given the wrong advice?
I think he was given the best advice that was available at the time, and I'm pleased that if he was symptomatic and got tested, then that's appropriate, and I'm trusting that he's in self-isolation and that now we can trace any contacts.
Do you think we need to take more of a precautionary approach?
I think we've taken a very strong precautionary approach right from the start, and just to reiterate, our testing rate is very similar to, or better than, many other countries, and similar to Australia. So I think we're testing, and we're endeavouring to test all the people who need to be tested.
So in words, what do you say?
GPs are worried about the amount of PPE and protective equipment that they have, and so there seems to be enough for hospitals, but they're not stockpiling for GPs, and they're concerned, should they be wearing protective equipment for all consults, for general things that aren't going through the phone lines, or, what's your advice? Where is that at?
So I can confirm we have a lot of PPE. The important thing is that it is at the places where it's needed, and one of the advantages of moving to dedicated community-based testing places is that people who don't have COVID-19 or possibly have it are able to be seen at general practices without the concern of any cross-infection. So in other words, general practice can just see people with other health conditions, not those that might be related to COVID-19. The other thing here is, of course, you've seen general practice now moving to more online or phone-based consultations, which is ideal and very appropriate at this point. There was a further question here.
Yes, the contracts that DHBs have with these testing facilities, would that restrict bringing in new technology? Would that restrict?
No. So even if I think about our existing laboratories around the country, they're big machines. There are 4 different firms that they hire those from, or they lease those from, and different reagents. So the nature of the actual testing is agnostic about the type of testing, and what we will do is make sure we've got access to the right testing in the right places. We'll continue to do that.
What do you say to those people in cafes and bars and restaurants who say, this is just like the flu, we can do whatever we want?
Well, I think I'd say what I think most New Zealanders would say, that they need to play their part and get with the program.
And what would you say to an employer still encouraging over 70s to come into work, people with respiratory illnesses?
Well, if an employer's doing that, they would have to be very confident that they were able to look after and protect those people. Our strong advice is that people over 70 and that people under 70 with pre-existing conditions are enabled to stay at home at the moment and stay safe.
What do you think the Deputy Prime Minister's going to work?
Well, I think the Prime Minister explained that very well the other day, that he's seen as an essential part of the country's workforce.
In Wuhan, even mild cases of COVID-19 were quarantined in field hospitals rather than self-isolation, which some have credited with reducing the infection rate there. Is that something you think we might need to consider here, sort of quarantining people in one place rather than having them sort of dispersed around different locales?
So one of the things we are able to do here, of course, is check on people who are cases or close contacts. So they do get daily check-ins, and they have to report in on their health and so on. We're also looking at options for quarantine, and whether that would be for people coming into the country and or others in the country where we weren't confident about their compliance with self-isolation expectations. One final question.
What would an area of quarantine look like? I mean, what sort of options are you considering there?
Well, of course, we've got the experience at Whangaparoa as a good starting point. So we know how to set it up quickly, how to make it work, and how to look after people.
Do you have the capacity for that?
Yes, we have the capacity, and there's work happening to increase the capacity if we need to do that quickly. Look, thank you very much. And a couple of days ago, I gave a shout out to the staff who've been working for a couple of months in this building on this response, and I now just want to thank the wider all of government team that is working tirelessly for New Zealanders to prepare for and make sure people are kept safe, and also to my many colleagues, health professional colleagues in the health system, whose work has probably just started, but they are incredibly dedicated, highly professional, and they are aiming to look after New Zealanders, and if you can look after them too, I'd be very grateful. Kia ora koutou katoa.
Thank you.